There's a big topic of what to do for patients who have failed bariatric surgery. And what do we mean by failed bariatric surgery? I think there's two main groups. There's those patients who have had bariatric surgery and are now suffering from complications related to their bariatric surgery. And the second group is patients who have had bariatric surgery who have failed to lose enough weight that they're dissatisfied by their bariatric surgery. And these are two completely different topics, so we'll cover each one of them separately. Right now, I'd like to talk about patients who have had bariatric surgery and are suffering from complications. There have been operations done throughout the past. It started with an intestinal bypass, and there are still patients alive who have an intestinal bypass. There was an operation that was done in the 60s and 70s called vertical banded gastroplasty or stomach stapling, and this operation has its own sets of complications, as well as patients who have had modern gastric bypass or gastric banding or even sleeve gastrectomy who are now suffering from complications. And when these patients come in, they're always scary. They're complex, and we know that addressing these complications is high risk and very complex. And this is something that I think should be done at centers who have a specific interest in this, because it is so hard and is so complex that the only way to get good at it is to do a lot of it. And revisional surgery is not for everybody, but it's something that we do regularly here, and we're interested in seeing patients who are having these complications. They can vary from chronic vomiting because some area in the bariatric surgery has scarred too small that it needs to be redone. It can be chronic ulcer disease, ulcers that won't heal despite adequate medical management. These often will require additional surgery to treat that. Patients who have had vertical banded gastroplasty or stomach staplings, some of these patients have been having severe heartburn, reflux, vomiting for 20 years to the point where their teeth have all been damaged. And often they come to me and tell me that they've been told that they're just going to have to learn to live with this, and that's not true. It's more complicated than the primary operation and certainly more dangerous than the primary operation, but these things often can be addressed and fixed. You just have to do due diligence to find a good center to get it done and understand the risk benefit profile, and that's something that we just will have to sit down and talk about. But a lot of the complications after bariatric surgery can be addressed. You just have to find the right person to help you with this.